New this morning, an increase in breast cancer diagnoses is behind a change to the screening guidelines one independent panel supports for when women should get their first screenings. The U.S. Preventive Services Task Force now says women should begin regular mammograms starting at the age of 40. Dr. Adipa Halaharvi is a breast surgeon for Ohio Health, and she's joining us live this morning on Wake Up CBus. Doctor, our viewers are familiar with you. We reported on your podcast. We're so glad you're joining us today because this is a significant move by the task force, but some would say it's a little bit late.
I would say so. It is a little bit late. I think their guidelines were released, I believe, in 2009, the last time. So they took a long time to update them. And even then, it's just a draft recommendation. And so they're still looking into research. And I'm really happy that they are recommending to starting at age 40 for average risk women, then at 50. What I'm still not happy about is they recommended every other year. And they really don't have any recommendations for dense breast tissue or those women who have dense breasts.
And can you talk a bit more about that? This is your specialty. Why this change in recommendations or this catch-up is necessary? What are you seeing?
So this is extremely important. I mean, we at Ohio Health, fortunately, do follow the NCCN guidelines, which have recommended starting screening mammography at age 40. But, there are physicians in the country who don't follow those recommendations, and they were following the USPSTF guidelines to start at age 50. 40% of the Black women are higher death rate for Black women compared to white women, and it's because they get diagnosed with breast cancer at much younger ages, and there's no screening recommendations for those group of people before age 40. And I really think someday, hopefully, we will start screening earlier for those group of people because the mortality rate is just so much higher in Black women compared to white women.
And you point out the annual check screening because these recommendations are every other year.
That is correct. We do need to do them every year because there are those interval cancers that can get missed. And about 20 to 25% of the women who die of breast cancer are between 40 and 50. Mm-hmm. And there are a number of studies to show that starting screening mammography at age 40 decreases death rate, and also early detection leads to good prognosis, regardless of the race.
And you and I, of course, being breast cancer survivors, we know this. I wanted to close out our interview by having you sort of bottom line this for our viewers who are getting all of this new information. Give us the basics on what women need to know for their breast health.
Yes. So for average risk women, meaning you're not considered high risk for breast cancer, you should start getting your screening annual mammography at age 40. And if you're one of those 50% of patients or group of women who are being told that you have dense breast tissue, we actually have Ohio House Bill 371, which has been passed in September of 2022, which mandates insurance companies to pay for additional screening with MRIs as well as ultrasound. Mm-hmm. So even though USPSTF has not made those recommendations, we do have a House bill which does mandate our insurance companies to pay for additional screening. So that's important to ask your doctor. One other thing I'll say is these are draft recommendations. So as you can make a public comment between now and June 5th, by visiting task force website, and urge them to reconsider their position of going every year rather than every other year starting at age 40.
All right, that advocacy so important. Dr. Adipa Halaharvi from Ohio Health, thank you so much for your expertise and for joining us here this morning. Have a great day.
Thank you so much for having me. Mm-hmm. Bye-bye.
Bye.